Hello, I'm Joe Ambrosio. I'm going to explain what population health is and the distribution of health outcomes within a population. Population health is defined as the health outcomes of a group of individuals and the distribution of outcomes within that group. The overall health of a person could be directly correlated to the socioeconomic state in which they live. The environment in which a person lives has an effect on the health outcomes of them as an individual, but they may also be within a range of multiple elements affecting the peers who live in the same environment. From a population health perspective, health is not defined as a state free of disease, but how the capacity of people can adapt and respond to their specific challenges. Let's define what a population is. A population can be defined as a culture, a community of any size, including a neighborhood, a city, a town, or even a building, or an age group, either sexes, or a group of people who experience a large event, for example, like a Vietnam veteran. It can also be defined as a group of people of certain economic status, regardless of a culture or where they live. Epidemiologists have determined that some health outcomes are directly related to the socioeconomic status of a group. To understand population health, we must look at what the definition of epidemiology is. Epidemiology is a branch of medical science that deals with the incidence, distribution, and control of disease in a population. An epidemiologist looks at the sum of the factors controlling the presence or absence of a disease or pathogen. They also look at patterns, causes, and effects of health and disease conditions in defined population. They inform policy decisions and policymakers using evidence-based medicine by identifying risk factors for disease and targets for preventive medicine. To understand epidemiology, we must look at how they do their research and how they draw conclusions using data analysis. A methodology is a scientific practice to identify the most suitable set of methods for leading researches and analyzing matters with specific data components that lead to summarizing information, either quantitative or qualitative. A methodology does not necessarily provide solutions, but rather offers the theoretical instruments for understanding how a set of methods or so-called best practices are compatible with the specific context where they could be implemented. An epidemiologist understands the importance to recognize the common health issues within a population so they can be treated and prevented. For example, many poor communities have a large obesity rate due to their lack of funds to afford healthy food options. This could lead to a plethora of problems, including heart disease, diabetes, and certain types of cancer. It is important to interpret the data correctly and have a sound methodology to assure these conclusions are clear. Here's an example of income inequality and some population health concerns. As you can see, the lower the income, the higher incidences there are of diabetes, higher blood pressure, heart disease, stroke, and lung disease. Some conclusions can be made here with low income correlating with preventable disease. It is important to recognize population health in communities where similar health issues can be treated and prevented. This can be done through population health management. Population health management provides comprehensive, authoritative strategies for improving the systems and policies that affect healthcare quality, access, and outcomes, ultimately improving the health of an entire population. It can also deliver essential research on a broad range of topics, including the impact of social, cultural, economic, and environmental factors on healthcare systems and practices. There are some conclusions we can draw from looking at health through a population. After identifying the problems within a population's health, action must be taken from these conclusions. After concluding the data is clear, identify the causes for these health problems. For example, if a female population in a community has a high incidence of cervical cancer, there could be many obstacles for those women. They may not have access to an OBGYN clinic for examination. Maybe they cannot afford health insurance, or maybe it's an aging population for women at higher risk than normal. These are ways to look at healthcare through a population affected in similar ways and can be improved on in similar ways. Rather than seeking out individuals for improved healthcare, using population health, you can attack the problem from a large scale with better results. Identifying the community's greatest healthcare risks and determining how to improve these needs will almost certainly improve its overall health. Thank you for your time.